what do I do as a general pediatrician in helping manage patients with autism spectrum disorder? Like, what's my role at that point?
So your role is really important, and I think that I'm always trying to help my patients find the right pediatrician once a diagnosis is made. Okay. Your role is really to be the, their guidepost. From the standpoint of making sure, are they happy with their services? Are there ways that you can help advocate to get more services? Are there new co-occurring conditions that are occurring that require referral to a specialist, right? It's autism, as we talked about in our role play, it's a lifelong evolving process and condition, and new challenges, new issues come up all the time, and you need a point person. And I think the pediatrician is the best professional to play that role for a family. And so I think, along those lines, I think having a really sort of safe and comfortable relationship with the family where they feel comfortable coming to you to talk about alternative therapies that they're trying. There's so much information on social media and just on the internet about various therapies, most of which are not evidence-based, that parents want to try. And if they have a place that they feel that they can come and feel comfortably ask without feeling judged or ashamed, that actually goes a long way, because then they're going to actually take your input, right, and take your advice and maybe choose not to pursue a treatment that could even be harmful. We have parents who are trying hyperbaric oxygen and chelation and stem cell infusions and all these things that, are none of which have been shown to be effective and can be very expensive and sometimes even harmful to the child. And so if they feel that their pediatrician is someone to whom they can turn to talk, that will be incredibly impactful in terms of what they choose to do.
It's kind of like even with your adolescents, where you just, if you ask about the drugs, or if you ask about then they're more likely to tell you than just say, are you doing anything? They'll say no. I guess the same thing is true with parents who have children with autism. Just asking, are you using any medications, or are you doing any therapies, or have you met with any other providers that are trying to help you, because maybe they're meeting with someone in the neighborhood or someone in their community who works on lead chelation, and it's maybe not what's going to be the most helpful, but just asking. What do you do when a parent is trying to do restrictive dietary things? Like, I'm taking out gluten, and I'm taking out lactose, and I've taken out this, and I see that a lot where they have these significant dietary modifications for their behaviors. How do you suggest we guide them?
It's a great question. You're right. The gluten-free, especially, diet is very common. So in general, with any therapy that is what we put in the category of kind of complementary alternative, CAM, my discussion with the parents is around risk-benefit. Okay, so, and risk does not just mean like bodily harm, right? Risk can be cost, it can be quality of life, those sorts of things. And so with the diet, there's some cases where having a gluten-free diet actually forces the child to eat much more healthily. They're eating more fruits and vegetables. More vegetables, and they're they're not just eating these processed starchy foods, and it turns out that it's actually very good for their overall well-being. There are other cases though where that gluten-free diet is very expensive and not cost-effective for the family at all, and it actually is leading to more restriction because some of the foods they love the most they cannot eat, and so that affects the child's overall nutritional well-being and again quality of life because they're missing out on foods that they really enjoy. So if it's the latter, I'll have the discussion with the parents about the fact that we don't have any studies that have shown that the gluten-free diet changes behavior or helps autism.
Okay.
Right? And
so if it helps them with eat better and just kind of like from a just dietary standpoint, that's fine. Right, but if it's not, especially as someone who with autism who may be really picky as it is. If you take away their pizza, one thing they'll eat.
Right. Now, again, there are certain instances where for parents, it feels like this is an area they can, control. And so it feels like they're playing a role in helping their child. And I don't want to take that away from them because it's not harmful in itself.
Okay.
Many people are gluten-free and they eat everything they need and they're healthy. Okay. So, but so that discussion is actually a little bit easier than some of the discussions around, again, like chelation or hyperbaric oxygen, where it really, not only is it not evidence-based and it's really expensive, but like chelation, there's been deaths reported from chelation.
Oh my God.
And so there are certain therapies where I do take a stronger stance.
Okay.
And again, I never want a parent to feel judged because I fundamentally believe, and I think hopefully we all believe this as pediatricians, is that, in the end, like parents want what's best for their child.
out in the past.
No matter how they get there and the choices they make, like we're, as parents, like we want our children to be happy and healthy. Yeah. And so I always remember that. And so I don't approach it from a space of judgment.
Good.
Because I haven't been in their shoes. I haven't had to make those decisions. And so I really, really respect the fact that the parents are trying to do their best. And I think it's our role as clinicians to help guide them along that journey and maybe help steer them a little bit so that they're not making choices that really are kind of ill-advised and might be harmful, because I don't think that's ever their intent.